Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week. You made it to the middle. Congratulations. It's all downhill from here. Hopefully you're looking forward to another weekend already. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Wednesday, May 26th, 2021. Going to look at 6 areas of health and wellness. Somewhere around the video, you can read through all 6 areas. If you have any questions or you'd like a copy, DM us on social, send us an email, give us a call at the clinic. We'd be happy to get that to you and or answer those questions you may have. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, we will share with you some information that may spark that certain decision or action or step maybe that you've been wanting to take or didn't know that you should take, and it may just help head you in a good path today by tuning in, tapping in, and turning on some of this good information. So congratulations for being here. Always nice to have you. Journal of the American Medical Association Network Open, April 2021, looked at the correlation of preeclampsia, which is high blood pressure after the 20th week of pregnancy, and that correlation to stroke risk later on in life. And they found that from over 1,400 women in the Framingham Heart Study, that association is involved a 3 times increased risk for stroke later on in life. So, of course, it's a medical study, so they encourage physicians to consider aggressive treatment of midlife vascular risk factors, including high blood pressure and elevated cholesterol and glucose levels for those individuals. However, there may be a perspective as well if you had such a challenge during your pregnancy that you contact also a paramedical provider to see how you can ensure your lifestyle choices and factors are helping support those 3 key areas of your body function as well to mitigate and hopefully eliminate those stroke risks later on in life. So very encouraging to those who may have had or will have at some point during a pregnancy preeclampsia to know that that risk or association exists and to be sure that you take really good care of yourself, as you might be anyway, but even more motivation to do so now if that happened to be a situation for you or someone you know. The journal Hypertension, April 2021, looked at salt sensitivity and how that can drive high blood pressure risk. The results from a 7-year study that included over 1,600 adults suggest that individuals with a greater sensitivity to salt are 43% more likely to develop hypertension than those with a moderate sodium sensitivity. So, I would want to look up exactly what they mean by sensitivity to salt. Some people, of course, you may have heard of super tasters. They are very sensitive to different flavors and can distinguish them maybe differently or better than other people in the population. And some of that may associate with having a higher sensitivity to salt as well. Sensitivity to salt may also be the role that it plays for some in terms of a risk factor with hypertension. It's not the same for everybody. And of course, if you already have hypertension, salt it may be something that you want to avoid or stay away from. But the research isn't necessarily clear that salt's the only factor or leading factor even in creating hypertension. So you'd want to customize, individualize, and personalize your decisions around that. However, you probably would not be badly off unless you're an endurance athlete from avoiding excessive or added salt to your foods and other aspects of what you might be consuming. It's usually in most cases unnecessary. Things taste pretty good even without it if you try it, right? The American Physiological Society, April 2021, asks if you have 10 minutes. In a recent experiment, researchers observed that 10 minutes of high-intensity cycling performed 3 times a week for 8 weeks can improve maximum oxygen consumption, anaerobic power and strength, and total blood volume. Some good physiological improvement by just doing 10 minutes high-intensity cycling 3 times a week. Now, if you were to 3 times a week go for a longer walk, maybe 40 to 60 minutes, and then also do some resistance exercise for 10 or 20 minutes, full body circuit work, I think you'd be doing enough to really keep yourself in good stead when it comes to your exercise, fitness, and activity levels over a lifetime. So it really doesn't take much. It's just a matter of creating a plan that works for you and you see results from, and then to stick with it over time. It's that stick-to-itiveness that we often lack, but don't worry, it's also okay to take a break once in a while as long as we get back to it, all right? Vitamin D supplementation during pregnancy may also benefit the baby, according to the Sao Paulo Journal of Pediatrics, May 2021. They did an analysis of data from 44 clinical trials, and they found that vitamin D supplementation during pregnancy may positively affect calcium metabolism, physical growth, and immune system development early in life of the child. And vitamin D supplementation is actually one of the supplements even the medical association largely supports early on in life, even for infants and toddlers and our children. So good to know that the research supports such recommendations, and it could start as early as making sure mom has access to and good levels of vitamin D and gets passed on to the baby in utero. Very interesting. Finally, the Journal of Dental Hygiene, April 2021, is looking out for all those dental hygiene students out there, because neck pain can be very common among those students already, even before graduating and working in their career. Dental hygiene students showed that bending the neck forward by more than 20 degrees during their scaling procedures significantly increased the risk for neck, upper back, and shoulder pain. The findings reveal the need for ergonomic training for dental hygiene students to help reduce the risk of future work-related musculoskeletal disorders. And of course, ergonomic concerns, not just at a computer or desk and similar station, but also with people who are engaged in more physical labor, assembly lines, different kinds of trades, but definitely with hygienists, stylists. There are some strategies that we learn from our teachers and professors that are probably valuable, and we may not focus on those as the key things that we learn through our programs. However, they are some of the small tidbits of information that can save us through our career when we adhere to understanding the body mechanics behind what we do and how we do it. So the ergonomics involved with many of these careers is very valuable, and in our office we try to garner a good sense of what someone's doing and how they're doing it all day, and recommend fundamentally based on biomechanics what a better ergonomic approach may be for that task. And certainly we've done so with many hygienists and stylists for that matter. And it's a very valuable skill to have, an awareness to create a habit around, so that when you're doing what you love to do, helping people each day, you're doing it in a way that doesn't damage or hurt you and your ability to do it well. So ergonomics is very valuable, not just at a computer, but many other situations as well. All right, that's your daily health update for Wednesday. It was a good one, some good information in there. Hope you enjoyed it and enjoy the middle of your week. Tomorrow's Thursday. We'll be back with another daily health update for you. We look forward to chatting with you then. Until then, share some smiles, share some hugs, lend a helping hand when you can, and everybody will be better off for it. So thanks for doing that. We'll talk soon. Take care.